Yeah, this is Dr. Caudill Miller with Dr. Miller's Guide to Neurology, and we're going to start a new topic today. We're going to talk about seizures and epilepsy. And this is another one of those complicated topics. And, when we talk about teaching residents and students, I generally feel like treating clinically, the three hardest topics in neurology to really get it together when you're treating just thousands of patients with this disorder are headaches, epilepsy, and multiple sclerosis. A lot of the diagnoses in neurology are single diagnoses, but epilepsy with all the drugs, headaches with all the drugs, multiple sclerosis with all the drugs. It's just very complicated. And we just finished a really good series on headaches, and we'll continue to expand on that. And we're going to start today and talk about seizures and epilepsy. And the topic today is, do I have epilepsy? Do I have a seizure disorder? In 2017, there's a new classification of the different seizure disorders that came out. I read this thing, very confusing to me as a doctor. I read it 3 or 4 times. I just got back from New York and I saw Coco Gauff win the U.S. Open. It was pouring down rain. We were walking through Times Square. We were under the overhang. Everybody smoking dope. Everybody selling dope. I mean, my eyes were just watering like crazy. And I wonder if these guys and gals who were doing this epilepsy classification, they were sitting around smoking dope when they did it, when the first time I read it. The more I've read it, the more I understand the method of the madness, and I really think as they, modify it and make it a little more simple to understand, I definitely see the rhyme and reason why they're changing all these names of the different seizures, because they're trying to be very specific, because as the new epilepsy drugs come out, that have different mechanisms of action, you can tailor a drug more to a particular exact type of seizure. For example, all the different types of focal seizures now have different names. And I think what they're trying to do is a good thing. I just hope they don't change it again. I will say that, 10 to 15 years ago, there was this trend to quit using the term epilepsy, and I really like that. And we really started changing and encouraging our patients to, say they had a seizure disorder. And I think this new classification, if you have a focal awareness seizure, that's a lot better than saying you have epilepsy. 100 years ago, 50 years ago, 30 years ago, epilepsy just had a negative connotation. You tell people you have epilepsy and they act like you're retarded. There were some groups years ago, if they had a baby with epilepsy, they'd put them in a bag and throw them in the river. And so epilepsy has just always had a negative connotation. So I was a little bit disappointed that they're still, using that term. But it is what it is. So seizures are defined as transient symptoms and signs due to abnormal, excessive, or simultaneous neural activity of population of neuronal cells in the brain. So it's an electrical tsunami of electricity across the brain. Whereas epilepsy is defined as a chronic disorder. It's a chronic disorder characterized by people that have had more than one seizure. So a diagnosis of epilepsy requires at least 2 unprovoked seizures over 24 hours apart. And there's a lot of people now that are defining epilepsy as someone that even that's had one seizure but has a high likelihood of having another seizure. For example, someone had a gunshot wound to the head and had a seizure, they're very high likelihood to have another one. Someone that's had a stroke in the cortex, someone that has a vascular malformation of the cortex, someone that has a structural lesion on their MRI or CT. So today's topic is, do I have epilepsy? Do I have a seizure disorder? And history is critical. And when I'm teaching residents and teaching students and nurse practitioners and young doctors, the history is very critical. And there's multiple questions we need to ask on every single patient, because we're just trying to differentiate between whether this is a seizure disorder or whether this is a cardiogenic disorder, whether it's functional, whether it's psychological. So when did it begin? What is the date of onset? Find out when it was. Did they have a aura or warning? Many patients with seizures will have funny smells, like temporal lobe, from the temporal lobe, funny smells. They'll have automatism, lip smacking, eye blinking. And then they'll have the seizure. Did they have any alteration of awareness? The new classification is getting rid of the term consciousness and loss of consciousness. They're trying to change to the term awareness. I'm not totally sure, but we're going to try to cooperate with that. Do they have any generalized tonic-clonic activity or not? Are they incontinent of urine? Are they incontinent of feces? Do they bite their tongue? And what is the frequency of these events? Remember, more than one, and they're diagnosed with epilepsy. When was the last seizure? Do they have a post-event confusion, what we call post-ictal confusion? And what are their treatment failures? You'll find out what medicines they've been on, what doctors they've treated, what's their workup history. Have they had MRIs, CTs, EEGs? So, for example, a typical, generalized tonic-clonic seizure, and we're no longer using the term grand mal seizure, generalized tonic-clonic seizure, will be someone with sudden loss of consciousness without warning, generalized tonic-clonic activity, so jerking and stiffness with urinary fecal incontinence, tongue biting, post-event confusion. That's a classic generalized tonic-clonic seizure, very helpful. Whereas a focal seizure may have lack of awareness, confusion, and then they may present to a generalized seizure. So do I have seizures? So what we're going to do in the next videos, we're going to talk about the different seizure types. And looking through this new classification, which is very confusing, I'm going to break this down into the focal seizure disorder first and then the generalized seizure disorder, and go over all those different types of seizures with a new classification. We're abolishing a lot of the old terms. Grand mal seizures, we're not using that term anymore. Complex partial seizures, we're not using that term anymore. Simple partial seizures, we're not using those terms anymore. Petit mal seizures, we're not using those terms anymore. So we're going to talk about the new terms that we're going to use, and we're going to talk about the different seizure types. So I'm going to do a video next on the focal seizures, and then I'll do one on the generalized seizures. And then we'll do some videos on each drug and how we use them and how we're going to treat seizures. And we'll do evaluation of how we work people up. So subscribe, like, comment, and more later.